In this presentation, we are going to look at health in disaster and conflict. This presentation provides some foundational information and thoughts related to health in disaster and conflict. All the ideas are to be challenged, so please feel free to think and question what we are presenting here today. It's important when we talk about health to understand the diversity of health. We need to think about the channels, we need to think about different population groups, we need to think about disease patterns to understand this diversity of health. And through analyzing this diversity, we would be able to develop and implement effective and efficient targeted interventions. Here are some of the different examples of the diversity of health situations. These are mothers who are waiting for the clinic in South Sudan outside in the waiting area. Or we could think about a traditional healer in a place like Malawi, who is the primary healthcare provider to certain refugee and displaced communities. Or you go somewhere like Sri Lanka, where the midwife at the community level plays a key role in providing healthcare to disaster and conflict affected communities. What really defines health? When we think about health beyond the popular definitions by the World Health Organizations or various academic concepts, health has ecological and economic content. Also, it has ideological and political content. When we talk about the human's relationship to their environment, their ability to buy health, access health, but also it's important to understand ideologically what do you mean by health, and also health is political in most disaster and conflict affected settings. Understanding the constitutive composition of health status in context is the basis for effective and efficient prevention and control of disease. Health in disaster and conflict. Health is a core sector of humanitarian aid interventions. It's very important to understand health is the main reference for measuring overall humanitarian responses. When we talk about disaster responses or conflict responses, we talk about the numbers of deaths, numbers of disease infections, and so on, where health becomes the center of most humanitarian interventions. Over 300 million people each year are in need of humanitarian health assistance as a result of disasters and conflict worldwide. Health interventions in disaster and conflict. Health in humanitarian settings is changing, mainly because of the patterns of disasters, patterns of conflicts are changing. People's access to healthcare, agencies' ability to deliver healthcare is changing. And also, there is a huge change of disease patterns towards chronic non communicable diseases such as diabetes, cholesterol, and so on. The health risks associated to growing urban populations bring new challenges. About 15-20 years ago, we were talking about refugees in rural settings, IDPs in camp settings. Not anymore. When we look at most of the conflicts and disasters in Asia and the Middle East are very urban. That brings different health challenges. In humanitarian health, the priority has always given to prevention of infectious diseases. In any disaster or conflict setting, the agencies are rushing to prevent infectious diseases such as measles, mumps, malaria, and so on. However, people with non communicable diseases are missed out in most humanitarian responses, but also in recent humanitarian situations like Yemen or Syria. The agencies are finding to find the finance and resources to respond to non-communicable diseases such as kidney failures or cancers. Health logistics are always a challenge. Vaccinations and equipments are heavy to transport and difficult to store. Assessments of affected populations are important. However, the social, cultural, political, economic, and environmental contexts make assessments a challenge. The class, caste, gender, and other power imbalances within any affected population make the assessments difficult. Meeting diverse health needs of an affected population is also another challenge. Different people belongs to different age groups, different gender groups, and so on are bringing different health challenges. In conclusion, it's important to look at health interventions at three levels. How do we disaggregate the situation and understand the situation and how we target our interventions accordingly? Thank you very much.